no.
Question number 7, Barbara Stewart.
Thank you, Mr Speaker. My question is to the Minister of Health and asks, what reports, if any, has he received regarding the proposed closure of Kenepuru Hospital Accident and Medical Centre overnight?
Mr Speaker.
The Honourable Joe Goodhue.
Mr Speaker, on behalf of the Minister of Health, I have been advised by Capital and Coast that they are exploring the option of replacing the Kenepuru A&M overnight service, which sees around 1 patient an hour, with a more effective model, the urgent community care model, which has been trialled in Kapiti and Horowhenua since 2009. In Porirua, it's only a concept at this stage. It's being explored by a working group which includes community stakeholders, GPs, Wellington Free Ambulance, Porirua City Council, Pacific Groups, Kenepuru Consumer Committee members and DHB staff. Should the concept exploration result in the development of a proposal, full community consultation will be undertaken next year.
Barbara Stewart.
Has he been made aware of how the proposed changes for Kenepuru Accident and Medical would improve services in the Porirua Kapiti area? And if so, how will these services be improved?
The Honourable Joe Goodhue.
Mr Speaker, on behalf of the Minister, what I have been advised is that in the Kapiti area, the UCC model which I spoke of has successfully met the needs of the 5,000 patients in Kapiti for 3 years. It provides an urgent and medical response by sending specially trained...
Point of order, the Honourable Trevor Mallard.
I have a problem on the crossbench, Mr Speaker.
Sorry?
Oh, no.
Order. That is not helpful to the order of the House. The member interrupted a minister's answer, and that's not helpful. The Honourable Joe Goodhue.
Mr Speaker, in terms, the member has asked about improvements in the Kapiti and Porirua area. In Kapiti, what I'm advised is that the needs of the 5,000 patients there over the last 3 years, that the model has provided an urgent and medical response by sending specially trained advanced care paramedics and really well-equipped vehicles to the patients, providing treatment in their own homes. In terms of perhaps speculating on what the improvements would be in the Porirua area, I would have to say, first of all, that what it would mean is that the treatment would be free. At the moment, the patients who attend the A&M have to pay between $34 and $60 unless they're under 6. So first of all, it would be free. Secondly, the treatment would be in their own homes, which in the Kapiti area they have said is certainly what the patients prefer.
Very good.
Barbara Stewart.
How can he ensure that Capital and Coast District Health Board in the Porirua Kapiti area are providing quality care if Kenepuru Hospital goes ahead and closes its accident and medical overnight, replacing it with roving paramedics with far less training and experience than doctors?
The Honourable Joe Goodhue.
Mr Speaker, on behalf of the Minister of Health, these are specially trained paramedics, not just the paramedics that currently staff ambulance, but they have actually had specific training over and above those of paramedics who staff ambulances. The Kapiti model does give us some confidence that this has been working well, but in fact where the paramedics arrive at the person's home and find that treatment by a doctor is required, and I'm told that currently about 1 or 2 of the 10 or 12 that are seen each night would go to the emergency department in Wellington, then they will still go to the emergency department in Wellington where they will actually have medical care. So this is another option that is seen to be a better, sooner and more convenient option for the patients of the region.
Barbara Stewart.
Are the proposed changes at Kenepuru Hospital Accident and Medical Centre the forerunner for a widespread change of health service delivery nationwide in a bid to save money?
The Honourable Joe Goodhue.
Mr Speaker, on behalf of the Ministry of Health, absolutely not. What these are options that have already been used in Kapiti for a better, sooner, more convenient system. Capital and Coast DHB, in fact, 4 years ago, was in serious difficulty. This government has put $100 million extra over the last 4 years into that DHB and $200 million more into deficit funding. This is not about cutting costs. This is about a much better, sooner, more convenient healthcare model for the patients of the region.
Question number 8, Chris Hipkins.
Thank you very much, Mr Speaker. Mr Speaker, my question is to the Minister of Education.